new topic, that is regarding the diseases of the newborn. And the first important lecture in this is respiratory distress syndrome, also known as hyaline membrane disease. It is common in preterms. This is what happens. This is due to decrease in surfactant. Have you ever seen a balloon? Whenever you try to inflate a balloon, some of the balloons you are able to inflate so easily, but some piece may be there where you need to blow very hard, or with great difficulty you are able to blow. So these surfactants also act like that. When the child is born, in some cases whose maturity is enough, the lungs they inflate easily and they start expanding and breathing and ventilation starts. But in preterms, due to the surfactant deficiency, the alveoli they remain collapsed, so they do not expand, so breathing doesn't start fully. This name of hyaline membrane disease is given due to the ground glass appearance on X-rays. Let us say you are in a cabin and doing your work, the glass is transparent. You can look the other side, some outsider is also looking inside, and you make it a ground glass so that no one else can see. So you must have seen that ground glass appearance. The same is there in the X-rays. There are no lung markings, only a ground glass appearance. That's from which the name of hyaline membrane disease has been given. So what is the cause? Main cause is the deficiency of surfactant. Already the lung is underdeveloped, there is a deficiency of surfactant, and this causes hyaline membrane disease. Surfactant production takes place as the gestation advances from 24 to 8 weeks. Here the surfactant production starts and maximum at 34 weeks. So if a child is born say around 28 weeks of gestation, then the surfactant level will be less. So such children are likely to develop this respiratory distress syndrome. Other reasons may be that the child has got maternal diabetes mellitus, or the child has gone delivery by lower segment cesarean section, और द मदर में से कि जो पहले मुझे बच्चा हुआ उसको भी ऐसी प्रॉब्लम आई थी. सो इफ़ देयर इज़ ए पॉजिटिव हिस्ट्री इन द previous child, then this child may also have more chances of RDS, right? So what can be the symptoms? So it starts presenting immediately after birth, but the symptoms and severity they progress in the next 48 to 72 hours. So how will the child present? It will be rapid shallow breathing. Rapid. Let us say the child is breathing at 60 minutes per minute, it will increase. He may now be breathing at 70 or 80 times per minute, but it will be shallow. If you breathe fully, the chest expands, but if you are taking shallow respiration, it will not be fully ventilating the lungs. So the breathing is rapid as well as shallow. This we call as a tapnea. Child may be having a grunting sound. Grunting sound means on expiration this sound is like this, just expiratory sound. As in the adults also, you must have seen when the person is very ill, he produces this type of sound. This is an expiratory sound. There may be flaring of the alae nasal. They also are a sign of respiratory distress. The child may be cyanosed, or the child may be getting apnea. The child may be having chest retraction. So how will you make this diagnosis? One is from the clinical features. All this. A premature child is born. He is showing respiratory distress over the next 24, 48 and 72 hours. His symptoms, they are deteriorating. This means he is probably having the RDS. What other tests you will order? Blood tests you will get. Blood sugar you will get done. Blood sugar, ABGs, X-ray, chest. So after reaching the diagnosis, what will be the treatment? First is the symptomatic and sportive treatment in these children till the lung starts functioning. जब तक के properly lung functioning start नहीं होती, you have to give symptomatic and sportive treatment. As the oxygen saturation is not taking place, you will give oxygen. How can you give? By the nasal cannula, nasal prongs, or you may, if the child is not improving, you can shift to CPAP, continuous positive airway pressure. You can note down, CPAP stands for continuous positive airway pressure. Or if the child is still not improving, then mechanical ventilation. कई दफ़ा कहते हैं ना, वेंटिलेटर पे डाल दिया. This is mechanical ventilation, right? So surfactant is also given in these children. How is it given? By the endotracheal tube. It is inserted directly into the lungs. And what will it do? It will reduce the tension in the alveoli. They start expanding up, breathing and ventilation, they start improving. Sportive treatment is also needed in these children till their lung function starts functioning properly. You have to maintain the temperature of the children. You need to treat the hypoglycemia. You will be giving the IV fluids and also controlling the infection if any, right? Now, can this be prevented? Definitely, this is a very important question, and it will always be asked how to prevent it. So you can first is you must try all measures that preterm delivery doesn't take place, and if it is not possible, then you must give the antenatal steroid. So if the delivery is taking place between 24 to 34 weeks, then you need to give antenatal steroids. There are two regimes. One is you can give beta-methasone. Here 12 milligram dose is given every 24 hours. आज 8 बजे सुबह लगा दी 12 मिलीग्राम, तो नेक्स्ट डे फिर लगा दी 12 milligram. So total 24 milligram in 2 doses. 24 are apart, 1 dose. Is it clear? Dexamethasone 6 milligram 12 hourly. That will also come to 24 milligram. सुबह 8 बजे, शाम को 8 बजे, 2 doses. Next day also सुबह 8 बजे, शाम को 8 बजे, तो 4 doses. When you are giving this, you should be very clear that the effect will come only if the delivery takes place 24 to 48 hours after giving these antenatal steroids. So if you have given antenatal steroids now and say after 2 hours delivery takes place, then the effect of these antenatal steroids will not be there. So you must take all precautions that once you have given antenatal steroid, the delivery is delayed for at least 24 or 48 hours for its effect to come. What will these do? They will accelerate the lung development and surfactant production will start. So this will prevent RDS. While giving this antenatal steroid, you must see that there is no contraindication, there is no active infection in the mother. Chorioamnitis is not there or any other serious infection. So if you want to ask, you can ask.